These are my head to toe papers, front and back. Hi there.
Hi.
How are you today?
Good, how are you?
I'm good, thank you. My name is Haley. I will be your nursing student doing your head to toe assessment today. Do you mind telling me your name, date of birth?
Allison Diener, 92804.
Good. Do you know where we are currently?
Saginaw Valley State University,
Good. Do you know the current year
2025.
and our current president?
Donald Trump.
Good. Okay, so you are ANO times 3, so I feel comfortable asking questions about your health history. Do you have any family history I should be worried about for your
No.
assessment? Okay. Any medical history you have yourself or pre-existing to this day?
I have IBS and ADHD.
Do you have those both still to this day?
Yeah.
Okay. All right. And how do those affect your everyday life? Are you medicated for those?
Yes, I'm medicated for both of them. Both my medications work really well.
Okay. So when you're taking those medications, it doesn't affect you at all?
No.
Good. Okay. And any side effects with those medications?
No.
Good. Any other medications that you're on?
No.
Okay. Any herbal supplements or vitamins that you're taking?
Mm-mm.
Good. Any allergies I should be concerned of?
No.
Any hospital stays recently?
No.
Any surgeries?
No.
Okay. What does your typical diet look like?
I try to eat around 2 meals a day. I don't eat breakfast because I'm not hungry in the morning, but I eat good sized meals for lunch and dinner with very little processed food, and I eat lots of fruits and vegetables.
Okay, alright. And then fluid intake, is it water
Around-
that you're drinking?
Yeah, I
Okay.
drink around 32 ounces a day.
Okay, alright. Perfect. And that keeps you hydrated?
Mm-hmm.
Good. Do you do any drinking of alcohol?
No.
Do you do any smoking? So that includes vaping, tobacco, weed, cigarettes, anything like that?
No.
Okay. Do you do any drugs?
No.
Okay. What does your exercise look like?
I exercise around 3 times a week. I try to get my cardio in.
Okay. Alright. And that works good for you? Don't have any
Yeah.
pain when you do that?
No.
Good. Okay. And then lastly, I'm going to ask what your pain is like today on a scale from 0, no pain at all, to 10, worst pain of your life.
0.
No pain?
No pain.
Perfect. Okay, I'm going to move into your vitals if that's okay with you.
Mm-hmm.
I'll go ahead and see the tips of my hands. Good. Do you prefer an arm that I put this on?
No.
And do you have any pain in your arms today?
No.
Good. Okay, go ahead and pull that sleeve up for me if you can. I'm going to feel for that brachial pulse. There it is, nice and strong. Okay. I got 128 over 82. Is that normal for you?
Yeah.
Perfect. Okay. Off your arm. Good. Then I'll go ahead and use this thermometer. Perfect. Got 98.9. That is within normal limits, so that is good there. I don't have a pulse ox on me, but if I did, I would check your fingers for clubbing first, which might mean that you're not getting enough oxygen in. But I'm not seeing any clubbing. I'll test cap refill. All are less than 3 seconds. That's good. If I were to put that pulse ox on your finger, I would expect you to be within the 95 to 100% range because I don't see any cyanosis either. Lastly, I am going to go ahead and check your respirations and your pulse using your radial artery. Is that okay with you?
Mm-hmm.
Okay. I do have to count each for a minute. Are you comfortable?
Yeah.
Good. Okay. I'll use this one since I just took your blood pressure in that arm. I don't want to skew my results. Okay, I counted 84 for your pulse, and then I also counted 15 for your respirations. Both are within their normal limits, so pulse is usually 60 to 100, and then respirations are usually 12 to 20, and you fall within both of those categories, so that's perfect. I am going to go ahead and move past your vitals. I didn't find anything concerning, so I feel comfortable moving on from those. And I will go ahead and check your skin if that's okay with you.
Mm-hmm.
Do you mind pulling your sleeve up for me?
Sure.
Perfect. I'm just going to kind of assess for temperature. I see that you have some moles. That's normal for you?
Yeah.
Temperature is good. I see you have goosebumps. Are you a little cold?
I am.
Okay. All right. I'm going to go ahead and assess this one as well. Both are nice and warm despite you being cold, so it's good. I'm not worried about hypothermia or anything like that, especially because I took your temperature and it was warm. Moles are normal here.
Mm-hmm.
Good. Okay. And then I'll feel for symmetry and tone in both arms. Perfect. Good. All right. Go ahead and shrug both of your shoulders for me. Good. All right. Those worked perfectly. That's your cranial nerve number 11, your spinal accessory. That seems to be working well.
Mm-hmm.
Go ahead and swim for me. I'm just going to test your range of motion. Go backwards. I don't feel any cracking. That's good. Do the same with this arm. And back. Good. No cracking there either. Go ahead and kind of act like you are doing some curls. I'm just checking your flexion and extension, range of motion as well. No cracking. That's good. Any pain doing either of those?
No.
Good. Okay. And then I'll have you turn your wrists for me. Good. I don't feel any cracking. That's normal for you?
Mm-hmm.
Perfect. Okay. And then I am just going to check for edema. I don't feel or see any, so that's good. I'm going to go ahead and check in between your fingers if that's okay with you.
Yeah.
I already tested your cap refill, so I don't need to do that again. Your hands are nice and warm. Go ahead and flip those over for me. I'm just kind of checking for any wounds, any lesions, anything that shouldn't be there. That's a freckle there?
Yeah.
Okay, all right. Nothing too concerning. I did see a few freckles, but because you know that they're there, and do you have a dermatologist?
I do.
Okay, you guys keep up on those. Perfect. And I'm not too worried about those. Go ahead and lift your skirt up for me. I'll go ahead and check your legs for the same thing. Before I do, go ahead and squeeze my fingers for me. Perfect. Go ahead and push my hands out. Push them in. Push them up. And then push them down. Good. Nice and strong. I'll go ahead and move down onto your legs. I'll feel for temperature and symmetry as well. I didn't feel any lumps or any bumps in your arms or legs, so that's good. You feel nice and warm. Color is nice and even on both your arms and your legs. I am seeing more freckles, but that's normal for you.
Yeah.
Good. Okay. While I'm here, go ahead and stick your legs up, or like move them up. Perfect. And move them down. A few more times. Good. I don't feel cracking, so that's good. And go ahead and move down again. I don't feel or see any edema. Are you okay if I take your socks off?
Yeah.
Set them behind me by your shoes. All right. Your feet are a little cold. Is that normal for you?
Yeah.
Okay. All right. I'm gonna just check your heels. They are a little red. That's normal for you as well.
Yeah.
Did you just have shoes on?
Yes. Yes,
Okay.
I did.
All right. I'm gonna go ahead and test your cap refill. Good. All or less than 3 seconds. That's perfect. Go ahead and roll your ankles or twist your ankles for me. Good. Go ahead and go the other way. I did notice some cracking on your left side. Is that normal?
Yeah.
Okay. All right. Go ahead and push my hands out. Good. Push them in. Good. Push them up. Or, I'm sorry, push them down and then push them up. Good. Okay. You have strength in your feet and in your hands, so that's very good. I didn't see any edema anywhere. I'll go ahead and check between your toes too while I'm down. I don't see any wounds or any lesions, anything like that. There's no pain in any of the body parts I just touched on?
No.
Okay. All right. You can go ahead and cover yourself back up if you'd like. Actually, while I'm down, I'll go ahead and test your reflexes. There's no pain in your knees.
No.
Go ahead and scooch to the end of the bed for me if you aren't already. Go ahead and close your eyes. Just testing your reflexes. Good. Good. Okay. All right. You can cover up now. Sorry about that. Next, I am just going to go ahead and work my way from all the way up to your head, all the way down to the bottom of your toes, if that's okay with you. All right. I'm just gonna go ahead and check my paper super quickly. Oh, perfect. Before I do that, I do want to check your pulses, make sure they are strong and symmetrical.
Okay.
These are your brachials. Good. Your radials. Good. And then I will go ahead and test your popliteals, your posterior tibialis, and then your dorsalis pedis when you're laying down, okay?
Okay.
All right. Now I feel comfortable moving on from that. Do you mind taking your hair out for me?
Yeah.
Perfect. Do you have any pain in your scalp today? Any irritation?
No.
Good. Any dryness?
Mm-mm.
Any bumps?
No.
Okay. Any moles that I should be aware of?
No.
And then any infestations?
No.
Okay. I will just take a look if that's okay with you.
Yeah.
First, I'll test your scalp for symmetry. Good. I didn't feel any bumps when I did that. Okay. There's no pain when I did any of that?
No.
Do you dye your hair at all?
No.
Okay. All right. I did see a mole in your hair. Is that usual for you?
Yeah.
Okay. All right. And your dermatologist knows about that?
Yes.
Good. Perfect. Okay. While I have your hair down, I'm going to test your occipital lymph node. Good. I don't feel anything, which is actually perfect. I'll explain that in a little bit. You can go ahead and put your hair up if you'd like.
Okay.
And then I do see that you have some holes in your ears where piercings would go. How long ago did you get those?
I've had them since I was like 12.
Okay, all right. And those healed just fine for you?
Yeah.
Good, okay. And there's not any pain in them today?
No.
Good. I'm going to go ahead and take a look in your ears. There's no pain in your overall ears today?
No.
Okay. Just going to feel for warmth. They're nice and warm. There's no pain when I do that?
No.
No pain in this one?
Nope.
Okay. Both are symmetrical. That's good. I'm going to go ahead and look into your ear. I don't see anything in your ear. Perfect. Did you ever get any tubes in your ears as a kid?
No.
Perfect. I don't see any blockages, anything like that. But then I also don't see any earwax. Is that normal for you? Do you use Q-tips?
I do.
Okay. And you're aware of the side effects that come with that?
I am, yeah.
Okay. All right. As long as you know. And then you have been answering my questions based off of correctly, based off of what I've been asking you, which indicates that your cranial nerve number 8, your vestibulocochlear, appears to be working just fine.
Okay.
I'm going to go ahead and move on from your ears. I might as well test lymph nodes before I do that though. This is your pre-auricular and your post-auricular, and I'm not feeling anything either, so that's perfect. I'm going to go ahead and palpate your face if that's okay with you.
Yeah.
Is there any pain in your face today?
No.
Temperature is good. Skin color's even. I see some freckles, but no acne. Is that normal for you?
Mm-hmm.
Perfect. Okay. Have you had any colds or any sinus infections recently?
No.
Alright, I'm just going to go ahead and feel your sinuses. This is your frontal. This is your maxillary. Good. Not feeling anything like that. Go ahead and bite down for me. Perfect. I'm also going to feel your submental lymph nodes, your submandibular. I'm not feeling anything like that. That's good. If I were to feel something, I'd want them to be soft and movable. If they were hard and I wasn't able to move them, I would be a little bit worried. But then I am going to go ahead and put this on your face, and you go ahead and tell me which region in your face you feel it in, okay?
Okay.
Alright, go ahead and close those eyes.
Forehead.
Perfect.
Right cheek.
Good.
Left cheek.
Good.
Nose.
Good.
Chin.
Perfect. Okay. So I just tested your cranial nerve number 5, which is your trigeminal. And I did so by having you bite down so I could feel your jaw, and then I did that with the sensory, putting it on your face. Go ahead and smile for me. Frown, puff out your cheeks, raise your eyebrows. Good. That's your cranial nerve number 7, your facial. That seems to be working good. I'm going to move on to your eyes, if that's okay with you. Is there any pain in your eyes today?
No.
Okay. Do you wear glasses or contacts?
Contacts.
How long have you been doing that for?
Probably since I was around 11.
Okay. So you see an optometrist at least once a year?
Yes.
Good. Okay. I am going to go ahead and just look into your eyes first. Go ahead and look up for me. Look down. Good. Scleras are nice and white. Your conjunctiva are nice and pink. And I don't see any redness or anything like that, so that is good. I'm going to test your cranial nerve number 3, your ocular motor, by doing a test where I put my hands here, and I will shine a light and make sure that your pupils constrict when that light hits. Good. This is your parasympathetic. Good. So your pupils are reactive to light. That's perfect. I'm going to shine a light on your nose and make sure that it falls into your eyes evenly. Good. And then your pupils did constrict and dilate at the same time, which does mean that they're equal. That's perfect. There's nice symmetry. I'm going to go ahead and put this pen light in front of you. When I say look at my hand, go ahead and look at my hand. That's to my left to your right by my head, okay?
Okay.
Pen light, my hand, pen light, my hand. Perfect. So your eyes accommodated. Lastly, I'm just going to go ahead and test for cranial nerves 3, 4, and 6, which are your ocular motor, your trochlear, and your abducens. And I'll do so using the 6 cardinal fields of gaze. Go ahead and watch the top of this pen light for me. Good job not moving your head at all. that your eyes are able to follow that smoothly, so that lets me know that those muscles are working pretty good. I didn't see anything out of the ordinary, so I feel comfortable moving on to your nose. I can't test for your cranial nerve number 2 because I don't have a Snellen chart, okay?
Okay.
Alright, go ahead and look up for me. I'm going to go ahead and look into your nose. Has there been any pain in your nose today?
No.
Okay, perfect. Alright, I don't see any polyps or proliferations, and your mucosa was nice and pink. Do you mind going ahead and covering your nostril, breathing in and out for me? Good, and again. Perfect. I also didn't notice a deviated septum. That's normal for you?
Yeah.
Perfect. I am going to go ahead and test your cranial nerve number 1, which is your olfactory. I'm going to put this in front of your nose while you have your eyes closed, and you'll tell me what it smells like, okay?
Okay.
Alright. Go ahead and close those eyes.
Coffee.
Perfect. Okay. That was right. I feel comfortable moving on from your nose down to your mouth. Your lips look nice and pink, and they look nice and hydrated as well. Do you mind going ahead and swallowing for me?
Yeah.
Good, and again. Perfect. That is part of your cranial nerve number 10, your vagus. I'm just going to go ahead and take a look in your mouth if you want to open up for me. Good. I see that your tongue is red. Were you eating some candy?
Yeah.
Gotcha. Your teeth look nice and white. I don't see cavities. I do see a built-in retainer. Did you have braces?
I did, yeah.
Good, okay. Mucosa looks nice and pink. Go ahead and say ah for me. Good. While you did that, your soft palate and your uvula both went up, which means that your vagus, cranial nerve 10 is working just fine. I also am going to go ahead and have you stick your tongue out, move it side to side. Good, that is your hypoglossal. That seems to be working just fine. And the last thing I want to test while inside your mouth is your gag reflex, which is accompanied, or which is in relation to your cranial nerve number 9, which is your glossopharyngeal. Go ahead and stick your tongue out for me and say ah. I'm just going to decompress your tongue. Good, okay. I didn't see anything out of the ordinary. Do you usually have a gag reflex?
No.
Okay, alright. And then I also did note that you have tonsils. You don't have any problems with those?
No.
Good, okay. Alright. Go ahead and put your shoulders together for me. I'm going to go ahead and feel your supraclavicular lymph node. I don't feel anything at all. Go ahead and rest back. I'm checking for skin turgor. Good. Before I check your cervical chain, which is your last lymph node that I have to check, I am going to go ahead and check your carotid arteries for bruits. If you do end up having some kind of blockage, I don't want to end up rupturing that on accident. Good. I'm not hearing any whooshing on this side or this side, so I feel comfortable palpating the both of them. Obviously not at the same time. That would make you dizzy or lightheaded or maybe even pass out. I don't want to do that to you. Good. Both are strong. I can't check for symmetry just because that could end up putting you in danger.
Mm-hmm.
But lastly, I am going to go ahead and check that cervical chain, and I'm not feeling anything, which I explained to you was good.
Yeah.
So I checked all of your cranial nerves except for that second one, which I can't because I don't have that Snellen chart. And that was the last of your lymph nodes that I had to palpate, so I do feel comfortable moving back behind you, okay?
Okay.
Alright. Go ahead and sanitize. And then while I am back here, I am going to go ahead and displace your trachea so I can push down and feel your thyroid as you swallow, okay?
Okay.
Alright, my hands are coming through. Swallow. Any pain there?
No.
Perfect. Push that over. Push down. Swallow. Good. No pain there?
No.
Perfect. Okay. I didn't feel anything out of the ordinary, so that is good. And then I am completely done with that portion. I'm going to go ahead and move into your respiratory portion if you're comfortable with that.
Yeah.
Perfect. All right. I'm just going to go ahead, check temperature. Temperature is good. And I do see you have some moles. That's normal for you?
Yes.
Good. Okay. And then go ahead and just bend over a little bit for me. Just check your spine. Perfect. Your spine looks like it's in proper alignment. Have you ever had a history of scoliosis?
No.
Perfect. Okay. All right. So I don't think I see anything else out of the ordinary. Go ahead and breathe in for me. Good. My hands didn't move. Go ahead and breathe in for me. There they go. Okay. So I assume her lungs end right around the edge of the end of her bra strap here. So when I make my way down, I'll just go ahead and have my 6th spot ending right underneath here. I am going to go ahead and auscultate your lungs first. I'm checking for clear lung sounds. If not, I might be a little bit worried, but every time I put my stethoscope on your back, you go ahead and take a deep breath in and out for me. If at any point you get tired, go ahead and let me know by putting one of your hands up, okay?
Okay.
I'm gonna go ahead and begin. Go ahead and put your scapulas back for me. Perfect. So I'll go ahead and start my C shape there. All right, perfect. Go ahead and rest. Good. Okay. All I heard was clear lung sounds. Was there any pain when you did that?
No.
Good. And then as I got closer, I did see some scratches on your back. Did you just itch your back recently?
Yeah.
Okay. All right. Then I'm not worried about that. I'm going to go ahead and percuss now. In those same quadrants or those same spots. Good. Okay. All I heard was resonance when I percussed, and that is exactly what I'm looking for, so I'm not worried about that at all. That was the end of the respiratory section. If you would like to go ahead and lay down for me.
Oh.
And I did take your pillow from you because I am going to go ahead and test you for JVD, so go ahead and look to the side for me. Good. And the other side. Good. I'm not seeing any form of JVD, but if I was, I would go ahead and sit you up at a 45-degree angle, assess again, and then if you didn't have any, I wouldn't check again, but if you did, I would go ahead and sit you up at 90 degrees and then assess again.
Okay.
But you didn't have any, so fortunately we don't have to do that. Go ahead and take your arms out of your sleeves for me if you can. And go ahead and get yourself adjusted. Have you had any pain in your cardiac region?
No.
Perfect. And I know I asked you about family history, but I'm just going to ask again. Do you know if you have any cardiovascular issues that run in your family?
No.
Okay. All right. I'll check quick for temperature. Perfect. Temperature is nice and even with the rest of your body. I see some moles, but I know that's normal for you. And you see a dermatologist, so that is perfect. Perfect. All right. I am going to go ahead and find that first clavicle on the right side. There's that first bone, first intercostal space, second bone, second intercostal space. This is your aortic valve right here that I'm listening to. Perfect, nice and strong. Listening for any heart murmurs. Perfect. Not hearing any heart murmurs there. First rib here, first space there, second rib there, second space there. This is known as your pulmonic valve. Go ahead and listen, nice and strong. All right. Checking for heart murmur. Perfect, saving that spot. Third rib, third intercostal space. This is your herbs point that I'm listening to. Nice and strong. Checking for heart murmur. Perfect. Nice and strong there as well. Perfect. I'll go ahead. Fourth rib is here. Fourth space is there. This is your tricuspid valve that I'm listening to. Nice and strong. Flip that around. This is listening for heart murmurs once again. Good. Didn't hear anything. Fifth rib, fifth space right here. I'll go mid-clavicular or nipple line, so I'll move over here. Just listening to the valve again. Turned around. Listen for any heart murmurs. Not hearing anything. I'm going to go ahead and flip it around and listen for 1 minute because this is also called your apical pulse and it's your most accurate.
Okay.
Okay. I heard 82 beats there for that whole minute, which lines up with the pulse I took from your radio pulse, so that is good there. Was there any pain when I did any of that?
No.
Good. And then while I have you laying down, I am just going to check for edema on your arm. I can't remember if I did while I had you sitting up, so might as well do it again just to be sure.
Okay.
Didn't see anything, so that's good. That might be a sign of fluid overload, just like JVD is.
Okay.
If you'd like to go ahead and put your gown back on, I'll move into your abdominal portion. Perfect. All right, before I even touch you, I just kind of want to inspect. You seem nice and symmetrical. I don't see any lumps, bumps. I don't see any abdomen distension, which is good. I don't see any visible peristalsis. I am going to go ahead and check for your aorta pulsating, which it is, and that actually makes complete sense because people like you who do not have as much adipose tissue, you are able to see it a little bit clearer. Good. Okay. And I can see from the end of the bed as well. That's the only reason it's going down there.
Okay.
I am going to percuss first since I inspected. And I'm just going to make sure that I hear five gurgle sounds in each of your quadrants, and then once I do, I'll move on, okay? All right. Start here at your right lower quadrant. Good. Right upper, and I'm barely applying pressure because I don't want to be unsafe. Left upper. Left lower. Perfect. I heard 5 gurgle sounds right away, so that's good. I am going to flip it over and use my bell to listen to your arteries, your aorta, or your aortic, your renal, and then your iliac, okay?
Okay.
I'll find your aorta by going from the xiphoid process and the umbilicus and meeting in that happy middle. Again, barely applying pressure. I'm checking for bruits. Good. Not hearing that at all, so I'll go ahead and go to renal. Good. No bruise, so I'll find the iliac crest and go right above that. It's your iliac artery. Good. No bruise there. Because I didn't hear any bruise, I feel comfortable going ahead and doing percussions. I'm going to do this, and I'm just hearing for timpani.
Okay.
Good. 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 Perfect. That's what I heard in all 4 quadrants. Just to test that is timpani, I'm going to go ahead and work my way up and hear for the dullness of your liver border, okay?
Okay.
One more time. There it is. So right around here is where I expect that to be. Was there any pain when I was doing that?
No.
Okay. All right. Lastly, I'm going to do some palpations. I'll do light first, and then I'll do deep. If your light palpations didn't hurt at first, okay?
Okay.
All right. Any pain there?
No.
Good. Any pain there?
No.
Perfect. Any pain there?
No.
Good. Any pain there?
No.
Okay, and I do want to note, while I am feeling your stomach region or your abdominal region, it is nice and warm. Okay, I'm going to go ahead and do deep palpations before I do. There was no pain at all with that.
No.
Good. Just doing this to see if I can feel anything in your stomach. No pain?
No.
Good. And no pain?
No.
Perfect. Okay. That's the last I need to do for GI. If you want to go ahead and cover your stomach up, I am just going to go ahead and test your femoral arteries for symmetry, and then I'll also listen for bruits too, okay?
Okay.
This one is a little bit uncomfortable. I do have to reach down into your pants. Are you okay with that?
Yeah.
Okay. If you want to make like a frog-leg position with your legs, that'd be very helpful. I'm just going to go ahead and reach in and feel for them first. There's that first one, nice and strong right there. Go ahead and find the other one. Good. And that second one, nice and strong right there. I'm going to go ahead and use my stethoscope to check for bruise. And then while I had both of my hands in there at the same time, I did feel symmetry, so that's good.
Okay.
Go ahead, go in and find it again. Good, there it is. The stethoscope is right here. Not hearing any bruise. Then go ahead and move over here. Found it again. I'm right here. Good. Not hearing any bruise there. All right. You can go ahead and cover that portion up. I am just going to go ahead and move down to your legs and your feet. All right, I'm just going to uncover these. While I have you laying down, I'm going to go ahead and assess for edema. I'm not seeing or feeling any, which is perfect. I know I felt your temperature. I'm just feeling it again, nice and warm. I'm going to go ahead and feel for your popliteal pulse. There it is, right by this tendon or ligament that's behind the knee. Feeling for that other one. There they both are, nice and strong. I'm right here. Perfect. Okay, go ahead and rest. Go ahead and turn this one out so I can show the camera where I'm at. This is the posterior tibialis that I'm feeling for. There it is right there, nice and strong. Feeling forward over here. There they are, nice and strong. This is her ankle here just for comparison. And lastly, I'll feel that dorsalis pedis. Good. Perfect. Both are nice and strong. All right. And then the last assessment that I want to do on you is a sharp or dull test, if that's okay with you.
Yep.
I will use this little stick here.
Okay.
I'll let you know that this is what sharp feels like,
Okay.
and that's what dull feels like.
Okay.
Go ahead and close your eyes for me. All I need you to do is tell me if it's sharp or dull, which side of the body it's on, and then which region, like thigh, shin, foot, anything like that.
Okay. Dull right thigh.
Good.
Sharp left thigh. Sharp right knee. Dull left knee. Dull right shin. Sharp left shin.
Good.
Dull left foot.
Good.
Dull right foot.
Perfect. Okay, so you actually got 8 out of 8 correct, so there's nothing to worry about there. That's the last thing I had to do, having you lay down. If you did want to go ahead and sit up. Any dizziness when you're sitting up?
No.
I can tie this for you, okay?
Thank you.
Absolutely. So, the last thing that I'm going to do before I stand you up for your Romberg is I'm going to test your cerebellum functions. I do have a few tests that I can do that for. And then when I do sit you up, the Romberg, or do stand you up, there's a Romberg test. If I feel comfortable with your cerebellum testing, I will stand you up, have you stand shoulder width apart, arms slack at your sides, you'll close your eyes, and I'm just testing for your balance. So if you have any swaying, minimal swaying is normal, but if you have a lot of swaying, then I wouldn't feel comfortable ambulating you, okay?
Okay.
I'll hand you your socks. I'll let you put that on, and I'll gather the materials that I need for the cerebellum functions, okay?
Okay.
Again, do you feel any pain or dizziness while you're standing up or while you're sitting up?
No.
Perfect. Okay. Good. All right. Okay. Make an okay sign for me. And go ahead and touch both fingertips to your thumb. Do that as quick as you can. Perfect. That's one way to test it. Go ahead and put your hands down on your thighs, and then go ahead and flip them over. Flip them over again. Back and forth. As quick as you can. Perfect. Okay. And then go ahead and touch your nose. My pen light. 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 Good. Okay. I didn't see anything wrong with that. I am just going to go ahead and check my papers one more time.
Okay.
Just want to make sure that I didn't forget anything. I feel comfortable standing you up. Do you need any help putting your shoes on?
No.
Perfect. Okay, do you need any help up?
No.
Okay, go ahead and stand up for me. Feeling dizzy at all?
No.
Okay, go ahead. Shoulder width apart like we talked about. Hands like at your sides. Go ahead and close your eyes for me. Perfect. I'm not seeing any swaying at all. If you'd like to come over and stand here by me, we're just going to walk normally down to the end of the room. I'm just assessing your gait. Back around. Good. Okay. Because I didn't see anything abnormal with your gait, I feel comfortable having you do heel to toe. All the way down. Good. Then all the way back. Perfect. Okay. I didn't see anything abnormal there. If you want to go ahead and sit down. Before I let you go, I am going to go ahead and give you a quick braiding scale. Since you said you were continent and I felt all of your skin and it wasn't moist or anything like that, I'm not worried about having moist skin or anything like that. You are active, you exercise, you are extremely mobile, you're able to ambulate, your range of motion worked good, so I know that you can move yourself. You don't have any shearing or any tearing on your skin. You're able to feel like anytime I touched you. And because of that, I am going to go ahead and give you a braiding scale of 23 out of 23. Also because you have an adequate intake of food and water too. Do you have any questions for me?
No.
Okay, that's it. Thank you.
Great, thank you.